Valgus stress test for the ulnar collateral ligament. We want to really do it at multiple angles. So we'll start here at 20 degrees. Relax. Thank you. Okay, so you're just looking, positive sign is laxity. Okay. And the more angles you do, the more reliable the test is. Varus is for the lateral ulnar collateral ligament or the radial collateral ligament. So same thing. Just make sure they're fully supinated or it'll roll on you. Moving valgus, test the ulnar collateral ligament. So you're up in a cocked position, externally rotate the shoulder and add a valgus force to the elbow. Just flex and extend here. Okay, so this one's pain and laxity. You're in this angle right here. Hook sign, distal biceps tendon rupture. So you're gonna just palpate for the distal biceps tendon. Okay, supinate, and you can hook underneath there if they have an intact biceps tendon. So positive sign is inability to hook. Skip tennis elbow test, also called Cozen sign. So we'll be flex 90 degrees, palpate the lateral epicondyle, and you're gonna do a manual muscle test through wrist extension. So put your forearm down on the table, if you don't mind. Keep going. Yeah, you put them in a stool. Okay, so push up. Try to keep your fingers relaxed so we're not. All right, do that again. Okay, good. So we're looking for pain and weakness for tennis elbow, or for lateral epicondylgia. Tenel sign. I'm going in all kinds of weird order, sorry. We're just gonna tap the ulnar nerve through the cubital tunnel, looking for tingling, numbness into the ulnar nerve distribution.
Elbow flexion test.
Yeah, that's, oh, thank you, you're just reading.
Yeah,
I thought I skipped it.
No.
Elbow flexion test, so assume the position here. Yeah. So you wanna make sure he's fully extended through the wrist and fingers. We're gonna hold that there for 3 to 5 minutes. You time lapse that in the actual exam. Okay, but remember that for what was written. And then we're looking to see if he's having tingling and numbness, where he's having tingling or numbness, to see what nerve is irritated. So it'll either be the ulnar nerve or the median nerve. If it's median nerve, it's probably coming from pronator teres syndrome. Okay, ulnar nerves, just any type of ulnar nerve pathology. Pinch grip. So ask them to touch tip to tip. Right, if they go pad to pad, that's a positive test for anterior interosseous nerve impingement, again through the pronator teres syndrome. Okay. All right, wrist and hand. Varus valgus, anatomical position, valgus this way. Struggle for this. Testing the ulnar collateral ligament. Okay, so we'll do this in a neutral position. Okay, you're just looking for pain and laxity. Okay, for the UCL. Varus. Hold on to the thumb while you do that one. Okay, test the RCL. Squeeze test for Colles, Smith's fractures, other forearm fractures. Just don't squeeze right on the site of injury, looking for pain at the fracture site. Long bone compression for metacarpal fractures. Grab the entire phalanx, stabilize the carpals, and load the metacarpal. Okay, again, if you get this one on the skills test, pick a metacarpal and repeat it bilaterally. You don't have to test all 5 metacarpals. Scaphoid compression, very similar, except you're going to grab the metacarpal instead of just the phalange, stabilize the distal forearm, and load through the trapezium and the scaphoid. TFCC compression, we're just going to push fairly firmly in the TFCC area. Right, so you're just loading that area for pain. Murphy sign is for scapholunate instability. So you're going to find the scaphoid tubercle there, apply dorsal force, and add radial and ulnar deviation to the passive test. So a positive test is going to be like some shifting or clunking of the scaphoid, indicating that there's instability. Do not do this on a fractured scaphoid. Rule that out first. Murphy sign, McFist's bilateral. So you're looking to compare the height of the third metacarpal joint. If it drops down compared with the other one, so it's more level with the second and fourth, that indicates a lunate dislocation. So you'll look at it this way and you'll look at it this way, okay, to make sure that it's still the same height. Thumb MCP valgus, case for gamekeeper's thumb, skier's thumb, tear of the ulnar collateral ligament of the MCP joint. So we're gonna do a valgus stress test. We wanna do that in full extension and at different degrees of flexion. He's got a little instability, so I'm not gonna push very hard. So you're looking for laxity there, and whoever's his partner, please don't dislocate his thumb. Okay. Phelan. Okay, you can do this one hand at a time or both, but if you're doing it both, you still have to make sure that their elbows are in the right position, that they're applying some good force, so that you're maximally flexing the wrist. You're gonna hold that for 1 minute, checking for carpal tunnel syndrome, looking for tingling numbness in the median nerve distribution. Follow that up with reverse Phelan. Okay, same thing, hold it for another minute, carpal tunnel. And then Finkelstein. Okay, so they're going to ulnarly deviate, okay, as far as they can go. You're looking for fairly agonizing pain through these tendons here. So that's the abductor pollicus longus and the extensor pollicus brevis for de Quervain's tenosynovitis. That's it.